Most states have cut back public health powers amid pandemic Republican legislators in more than half of U.S. states, spurred on by voters angry about lockdowns and mask mandates, are taking away the powers that state and local officials use to protect the public against infectious diseases. A Kaiser Health News review of hundreds of pieces of legislation found that, in all 50 states, legislators have proposed bills to curb such public health powers since the COVID-19 pandemic began. While some governors vetoed bills that passed, at least 26 states pushed through laws that permanently weaken government authority to protect public health. In 3 additional states, an executive order, ballot initiative or state Supreme Court ruling limited long-held public health powers. More bills are pending in a handful of states whose legislatures are still in session. In Arkansas, legislators banned mask mandates except in private businesses or state-run healthcare settings, calling them a burden on the public peace, health, and safety of the citizens of the state. In Idaho, county commissioners, who typically have no public health expertise, can veto countywide public health orders. In Kansas and Tennessee, school boards, rather than health officials, have the power to close schools.
President Joe Biden last week announced sweeping vaccination mandates and other COVID-19 measures, saying he was forced to act partly because of such legislation. "My plan also takes on elected officials in states that are undermining you and these life-saving actions," he said. The KHN review showed that in at least 16 states, legislators have limited the power of public health officials to order mask mandates, or quarantines or isolation. In some cases, they gave themselves or local elected politicians the authority to prevent the spread of infectious disease. At least 17 states passed laws banning COVID-19 vaccine mandates or passports or made it easier to get around vaccine requirements. At least 9 states have new laws banning or limiting mask mandates. Executive orders or a court ruling limit mask requirements in 5 more. Much of this legislation takes effect as COVID-19 hospitalizations in some areas are climbing to the highest numbers at any point in the pandemic, and children are back in school. "We really could see more people sick, hurt, hospitalized or even die, depending on the extremity of the legislation and curtailing of the authority," said Lori Tremmell Freeman, head of the National Association of County and City Health Officials. Public health academics and officials are frustrated that they, instead of the virus, have become the enemy. They argue this will have consequences that last long beyond this pandemic, diminishing their ability to fight the latest COVID-19 surge and future disease outbreaks, such as being able to quarantine people during a measles outbreak. "It's kind of like having your hands tied in the middle of a boxing match," said Kelly Vollmer, executive director of the Jefferson County Health Department in Missouri. But proponents of the new limits say they are a necessary check on executive powers and give lawmakers the voice in prolonged emergencies. Arkansas State Senator Trent Garner, a Republican who co-sponsored his state's successful bill to ban mask mandates, said he was trying to reflect the will of the people. "What the people of Arkansas want is the decision to be left in their hands, to them and their family," Garner said. "It's time to take the power away from the so-called experts, whose ideas have been woefully inadequate." After initially signing the bill, Governor Asa Hutchinson, RRC, expressed regret, calling a special legislative session in early August to ask lawmakers to carve out an exception for schools. Lawmakers declined. The law is currently blocked by an Arkansas judge who deemed it unconstitutional. Legal battles are ongoing in other states as well. In Ohio, legislators gave themselves the power to overturn health orders and weakened school vaccine mandates. In Utah and Iowa, schools cannot require masks. In Alabama, state and local governments cannot issue vaccine passports and schools cannot require COVID-19 vaccinations. The Montana legislature passed some of the most restrictive laws of all, severely curbing public health's quarantine and isolation powers, increasing local elected officials' power over local health boards, preventing limits on religious gatherings and banning employers, including in healthcare settings, from requiring vaccinations for COVID-19, the flu or anything else. Legislators there also passed limits on local officials. If jurisdictions add public health rules stronger than state public health measures, they could lose 20% of some grants. Losing the ability to order quarantines has left Karen Sullivan, health officer for Montana's Butte-Silver-Bow Health Department, terrified about what's to come, not only during the COVID-19 pandemic but for future measles and whooping cough outbreaks. In the midst of Delta and other variants that are out there, we're quite frankly a nervous wreck about it, Sullivan said. Relying on morality and goodwill is not a good public health practice. While some public health officials tried to fight the national wave of legislation, the underfunded public health workforce was consumed by trying to implement the largest vaccination campaign in U.S. history and had little time for political action. Freeman said her city and county health officials group has meager influence and resources, especially in comparison with the American Legislative Exchange Council, a corporate-backed conservative group that promoted a model bill to restrict the emergency powers of governors and other officials. The draft legislation appears to have inspired dozens of state-level bills, according to the KHN Review. At least 15 states passed laws limiting emergency powers. In some states, governors can no longer institute mask mandates or close businesses, and their executive orders can be overturned by legislators. When North Dakota's legislative session began in January, a long slate of bills sought to rein in public health powers, including one with language similar to Alex. The state didn't have a health director to argue against the new limits because 3 had resigned in 2020. Fighting the bills not only took time, but also seemed dangerous, said Renee Mach, public health director for Bismarck, who testified against a measure prohibiting mask mandates. She then received an onslaught of hate mail and demands for her to be fired. Lawmakers overrode the governor's veto to pass the bill into law. The North Dakota legislature also banned businesses from asking whether patrons are vaccinated against or infected with the coronavirus and curbed the governor's emergency powers.
Thank you for watching. Please subscribe.